documentary that dares to suggest that ADD is not necessarily a total disaster.
ADHD stands for Attention Deficit and Hyperactivity Disorder.
3 core symptoms: attention, impulse control, and motor hyperactivity.
You know, a lot of people think that ADD is some sort of death sentence, while other people think it's nothing at all. Completely made up, not an issue.
There are many myths about ADD, and I think maybe that's the scariest, is that there are so many.
The amount of misinformation is incredible. The experts aren't sure of a lot of things, but some widely accepted theories have been shot down.
We have so much data, so much research behind it.
We probably are misdiagnosing it as things like anxiety disorders, depression, personality disorders.
Recognize, acknowledge, and accept that ADD can become an ally.
There's a feeling when you have unmedicated ADD that I don't feel good, I don't feel enough, there's something out there.
Moderate or severe ADHD that goes untreated leaves you really at a loss in life.
There's millions of parents and children who are suffering. As a former child and current adult and parent of ADD, trust me, I know.
We've built this. Your genes drive this.
What I learned to do in graduate school to treat ADHD, I would now consider malpractice.
Aspirin would be more dangerous than Ritalin.
So the good news is these medications used properly are safe and effective. Bad news is most people don't know that, and so they're human.
Now, whether you've heard that ADD submits you to a life of crime and suffering and possible cannibalism, maybe you've heard the complete opposite. It's all bull roar made up by the drug companies. Whatever you heard, be prepared to be surprised.
Here it comes.
Okay.
You're good.
So I got into this subject because I didn't really know much about ADHD. I just knew like a lot of kids were diagnosed with it. And so like I was totally that video. I didn't know what actually helped, what didn't. My mom works for a psychiatrist, and I just knew that she refused to see anyone that was just coming in for a prescription for the drug Adderall. If you're coming in for that, she didn't even want to see you because apparently that's really prevalent. So I just wanted to take like a better look at it and like do this presentation, and what I found, like I just want people to become more informed, because like we hear so much about ADHD. You've heard all the different things that they said, and like the more you look into it, the more you see that maybe we are really overdiagnosing, and that could be a huge problem, because with overdiagnosing means people are receiving medications that they don't need. So what is ADHD? You heard she gave a definition, but it's seen as an ongoing pattern of inattention and or hyperactivity. Impulsivity that gets in the way of daily life or typical development. There's 3 types. There's inattentive presentation. They call it presentation too. I think it's just so that it sounds nicer. And it's basically you're not really paying attention. You're like zoned out. Hyperactive impulsive presentation. You're always moving. You just like not only do you kind of seem like you don't pay attention to them, but now like people will see that you're like being rude or like you just don't want to be there, and so you're acting out. And then there's the combined, but I think that the combined is kind of a waste, because I think it's somehow, some way the two, inattentive and hyperactive, are pretty much intertwined. Why it matters. Up here, like there's like a lot of statistics, as you can see. Like take a moment to read them. But like I said, a lot of people are being diagnosed more and more, and this is why it matters, because we're juniors or seniors now, and so eventually we're probably going to have kids, or if we don't have kids already. And I think this is something that we really need to look at. Like you need to become more informed so that your kid is, when you're being told your kid is acting out in class or something like that, and their teacher goes, I think they need to be tested, you need to look at it like that. No, my kid's just just growing up, or yes, maybe we should have them go to like sessions and learn more about it before just accepting someone point blank saying your kid has ADHD or ADD, there's something wrong with your kid. And I think it should be really bothersome that the average age is 7 years. Like, there's a new DSM-5, and that's what psychologists use to make their diagnosis. That's pretty much their guideline. They moved that age to 12, but 7 is the age that it's already happening. And I read a lot of articles where they're saying 4 or 5-year-olds are going in because they're being told from preschool or kindergarten teachers. And those kids are also being medicated. And I think that that's a huge problem because they're still babies and they're developing, and putting chemicals, I think, into their system and drugs isn't the right thing to do. So these are the signs. Daydream a lot, forget or lose things a lot, squirm, fidget, talk too much. I'm pretty sure we've all done these. I'm pretty sure we all do these today. Like, when they say these are the signs, I mean, can anyone say they haven't done any of these things? Like, I just find it like amazing, like, oh, these are the signs to watch out for if your child has ADHD or if you have ADHD. You could just be listening to something totally boring or something you're uninterested in, or whoever's presenting could be really monotone. Like, if I stood up here and talked like this the whole time, I'm pretty sure you would all be doing this. You'd be like, oh my gosh, please stop talking. You would totally zone out. So I think that these signs just kind of show how, in some ways, how ridiculous it is. I'm not saying ADHD isn't something that's real. I think that it is real, that some people do need help, and sometimes parts of our brain are just too active or too, too active, and you just can't focus. Like, there might be something chemically off. But I think that the way that this is being diagnosed is too much. Like, there's got to be a way for us to adapt and not just put it off on being like, oh, something's wrong with you. I think giving someone a diagnosis is an easy way out of things when you talk to them. Diagnosing. So pretty much when it comes to kids being diagnosed, it starts with teachers. Teachers are saying, you know, your kid's not paying attention, I'm having behavioral problems with them, they're going crazy. And like I said, they're talking about this happening at the age of 7. You barely just got out of kindergarten and preschool. I mean, preschool is when you are running around being crazy and learning how to socialize. Kindergarten, you're kind of sitting in a classroom, learning how to write, learning the ABCs, your numbers. So I think that the age of 7 is just too early to fully diagnose anyone. And like with teachers, what I found out is that there seemed to have been a rise in diagnosing with the pass of the No Child Left Behind Act of 2001. And it's basically that states that score well on standardized, and like what came off of this is states that score well on standardized tests get more money. So why wouldn't you just have more kids be diagnosed, and you kind of have a handicap on what's seen as scoring well? And so I think that was like a huge problem. And ADHD, for some schools or for some cases, they'll move the child out of a regular classroom to maybe like a special ed classroom where they aren't being challenged. So in some ways their symptoms seem to get worse. Because like I watched a TED Talk, which maybe we'll be able to get to or not, but it was like he compared how he grew up in his schooling and his roommate, who he had roomed with for the past 4 years, and they were both diagnosed with ADHD. And so his roommate, I forgot what his name is, but his roommate was put into a school like 14 miles north of where he grew up, and when he had problems, they wanted to move him to another classroom. They said that he wasn't, he just wasn't paying attention, he was rude, there's disciplinary problems, and for the most part, he would act out when they were trying to tinker with his medication. And so this acting out was really because of the medication not being right if you wanted to be medicated or if you see that that's the best thing for you. Whereas the guy that was giving the talk, when he would act out because of his medication, he was given some leeway, and then the teachers would just adjust to however he needed to learn that day, or they would write a note home saying like, this medication isn't working. Whereas the other, when his roommate would get notes home that said, he's still acting out, but he's being quiet about it, so I guess the medication is kind of working, or up the dosage, which I just find to be like completely foul. The medication. These are a list of all the medications. Oh, actually, let me go back to page 9. Because I wanted to talk about the pediatricians and psychologists. So pediatricians, their clinical guideline is that the doctors should determine whether a patient's symptoms are in line with the definition of ADHD in the DSM. And for this, it requires days or weeks of sessions and work with this person, and they need to get like references and interview teachers, the parents, the actual child, and this needs to happen over and over, and they need to observe them and how in like their different environments. But this doesn't really happen. Instead, about 1/3 of a visit to the doctor lasts them less than 10 minutes. And then for the specific purpose of going into your doctor for a psychosocial evaluation is around 20 minutes. So these children are being diagnosed probably by them not even really answering. It's their parents going, oh yeah, that's my kid. They get up and run around at the table. Yeah, they don't listen to me all the time. They daydream a lot. I'll ask them to, or their teacher will be like, I asked them to do this and they were trying to play with the toys again. And so I think that this was like a huge problem. Like we can't even give them the proper amount of time to diagnose them. And then I had read a study where vignettes of different cases were sent to multiple psychologists, like all over the U.S. And these vignettes, some were actual cases of ADHD and some weren't. And the ones that actually had that weren't cases of ADHD, 16.7% of the doctors gave a positive diagnosis of ADHD. And out of those that frequently diagnosed ADHD, medication was recommended 33.3% of the time, and psychotherapeutic treatment was recommended 92.6% of the time. And I think that this is a problem only because, like, again, people are going to be medicated that don't need to be medicated. And I think when you're going to therapy at such a young age and the stigma that comes along with therapy just causes more problems for the child because they're like, oh, I must be crazy. Like, I've been going to therapy for this long. And, like, the stigma just keeps getting, like, worse and worse as they grow up. Because, I mean, even if, like in my psychology classes, like, we talk about who's been to therapy and no one will raise their hand. There's actually very few that do, and because that stigma is still so strong. And in psychology, like, they tell you to go. You might get extra credit for going to therapy. So you know some people are going, but still there's this stigma. And I think when you're 5 to 7 or 7 to 12 that are going to therapy and like you don't want to talk about it with your friends. That's not something you shared. Like your friends will see you as crazy or there's something wrong with you. And so I think people are really scared to show this. And this misdiagnosing, I think, hurts people in the long run, like overall, whether it be medication or actually going to therapy. The medication, this is just some of the medication that's prescribed. And like I said, okay, so Drug Enforcement Administration classifies stimulants as Schedule II drugs. Schedule II drugs are having high potential for abuse and with use potentially leading to severe psychological or physical dependence. The drugs that are on here that are part of this Schedule II list is Ritalin, Adderall, Vitazine, and Concerta. And what also belongs to Schedule II drugs, cocaine, methamphetamine, Demerol, and Oxycontin, excuse me. And like, if you know anything about this, is all bad. Like, we're putting kids on this at the age of 7.